Me gusta medicine, pero es muy permanente.
So many of my classmates have said, I took 10 years of Spanish in school, but as soon as I get in the moment, I'm nervous and I don't feel like I can talk and I don't know what to say.
I saw that really immersing myself just exponentially improved, and yeah, I really wanted to have that opportunity here once I had Spanish-speaking patients. I wanted to bridge that gap with them and make them feel comfortable.
Hay muchas páginas.
Trabajo en el hospital en la emergencia.
Charlar Con Cafecito. We're calling it a language exchange. So the whole idea is that it's very casual, informal. You come, grab coffee, and then half the time you're there, you're speaking in English, and half the time you're there, you're speaking in Spanish.
Toronto es muy bonito.
Muy bonito.
Hace frío.
When you have a language barrier, it really truly is different communities that don't interact with each other.
It's always been a goal of mine to become more fluent, and this has been really motivating. And even with the basics that I have, if I walk into a room with a Spanish speaker, it just creates a more welcoming environment. They'll even practice their English, we'll joke about it, and just bridging that gap to provide better medical care is the goal.
We were lucky to get a Texas Medical Association Foundation grant for what we're doing to support the work, and we wanted to demonstrate to them too that this is about language and culture, but we also do have that kind of health culture component built within it too. We had some dancers come in from the Folklorico. And then we were able to kind of talk about physical health and what does that mean to you, what does that look like?
Culture is actually what drives people into learning a language. And these students are going to go everywhere in the United States. Wherever you go, I think that they're going to have enough exposure to culture that when they get there, their sense of adaptability and curiosity for that culture is going to make them seek opportunities, and I think that they are going to be much better stewards of their profession.
I'm hoping that by attending these exchanges, you'll understand a little bit more about the culture of many of the patients in Fort Worth and be able to provide better care for them too.